Go with the flow.
Yes, 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 we are. All right. Good morning, good afternoon, good evening, depending on when and where you are watching this Facebook Live. This is the voice and face of Dr. Tolu Vinton, CEO, founder of Living Spring Family Medical Center here in the awesome city of Mansfield, Texas, where we believe in helping our patients live long and well because we believe the quality of life is just as important as the quantity of life. Before I forget, if you're joining us live, please hashtag live. And if you're joining us on replay, hashtag replay. But we have the one and the only Dr. Malini Khanna here joining us this early morning. How are you doing, Doc? Thank you for joining us.
I'm doing great. Thank you for having me.
Awesome, awesome, awesome. So, for the sake of those who are watching, please introduce yourself. Who are you, and what do you do?
So, my name is, as she had mentioned, Malini Khanna. I'm a physician in Philadelphia. I have my own practice, which is called Concierge Spine and Sports Medicine. I specialize mainly in lower back pain. So, I know it all from acute pain to chronic pain. And I'm also on a mission to help prevent lower back pain because there's so much that we can do ahead of time so that I don't have to be doing injections in your spine. So that's my mission, is to help prevent the everyday lower back pain. And then also I'm available if you do have back pain that's not getting better with conservative treatments. And I offer lumbar epidurals, facet joint blocks, ablations, and all sorts of procedures for your lower back, which we can get into.
Awesome, awesome, awesome. So I like the fact that you do the preventive, but I got you should you get to the point where you need the help. And today we're going to be talking about tips on how to work at a desk without back pain. And this is very very important to discuss because it's a very good preventive tool. And a lot of people have back issues from positioning at work. All right, but real quick, before we get into that, Doc, why do you do what you do? I'm always curious, and I'm sure the viewers are too. Why do you do what you do?
It's always a good question to ask. I really like doing procedural things, so that's how I kind of fell into this.
Okay.
And then it was that I just got really good at lower back pain. I was like, I got this. Like, so many people don't want to deal with the lower back
Mm,
pain. So many primary care doctors don't have solutions other than, get x-rays and go to physical therapy. And then here I come along and I like really studied it, really studied the stretches, the exercises,
mm,
all the procedures that you can do for back pain. And then I just became a lower back queen. Like I've become very specialized in kind of the first round of lower back pain. And then if I can't help you, then that's where a surgeon can come in. So I don't do any surgeries, but everything prior to surgery is what I take a look at. And I kind of um, knew, I saw there was a big need for it. And then
mm.
I realized I was really good at it. So then that's how I fell into it. And I'm really satisfied when people get better. So that's kind of how I fell into this. And then I also have a sports medicine background. So a lot of the sports players get back pain. So it just kind of meshes well with what my interests are, which is sports and spine.
Awesome, 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 awesome. And you're right. A lot of times with back pain, it's almost okay. What do you want to do? You don't want surgery, or get an X-ray, try physical therapy, stretches, muscle relaxants, and hopefully it gets better. Or sometimes I think patients are left to just make it a part of life. And it's interesting how much that affects your quality of life. You get irritable, you get cranky, you don't know why because your back hurts. You don't want to exercise because your back hurts. So I'm glad that you do non-surgical procedures that give patients option and less scarier options. Of course, surgery is not something you want to just do anyhow. So I love what you do, Doc, and thank you for what you do. And I like that you own your space. And like I love this so much. I learned the exercises, I did everything, and yes, I'm here to serve. So this is good. Now, first question: what are the three main reasons for back pain at work? I know there are more, but what would you say?
So three main reasons is sitting, because we sit a lot
Okay.
now with COVID and working from home,
Mm,
sitting. So what happens is you have your discs that are kind of like full of fluid, and when you sit, it gets compressed. And if you sit like that all day, all day, all day, all that fluid gets compressed, and then you can actually herniate or bulge discs that way if it's consistent. And then the opposite of sitting is lifting. That's a very common cause of lower back pain at work, is if you're lifting improperly or if you're lifting something too heavy. So if you're not used to lifting something, and this is a very common thing I hear, is that you went and lifted that water cooler, that huge jug of water because someone needed
Mhm.
it and they pulled it over. Don't do it without help, because then you're not used to lifting something that heavy, and then you're at risk for getting those discs, flattening it, pinching the nerve, and then you're in trouble. So sitting is a is a cause, lifting is a cause, and then what I'm doing right now, which is poor posture. I'm leaning forward so I can see you. So we got to sit up straight and kind of chest down, chest out, shoulders down, and have a good posture during the day. And we all do it. We all hunch forward and
Yes.
we're on our screens and you want to see what's going on.
Right.
So
Right.
sitting with your feet flat on the floor and the good posture, that will um, help. And again, we'll go over some tips as well. But those are the main reasons: is poor posture, sitting for too long, and then lifting.
So are you saying standing is better?
So it's alternating.
Okay.
So sit to stand. If you every 2 hours can change your position, it's kind of like when you have pressure sores. If you can change your position every 2 hours, that's the
Mm,
most reasonable. So if you sit, then you can stand up 2 hours and then sit back down for 2 hours. It's taking breaks as well can
okay.
help.
Okay. Now, who are people more at risk for back pain? I guess based on what the previous question, who are people that you see a lot come in for back pain?
So this people are surprised by this, but it's smokers. Smokers are at risk
Um,
now because the blood vessels in your whole body get restricted.
okay.
So there's a lot of blood vessels in your discs, in your lower back, but smokers are at risk for lower back pain. People who are older, people who have osteoporosis. So if you're not up to date on your DEXA scans, which you can order for them, people that sit all day, people that hold phones, like if you're holding your phone and on the phone all day and you're kind of like crunched up like this, they're at risk. So getting a headset can be helpful.
Hmm.
And then clearly the people that lift all day, like construction workers and push and pull heavy items, they're definitely at risk of getting lower back pain.
Okay. Wow. Smokers. Not surprising, but I wouldn't think that that's like a top, but interesting. And for those of you who don't know what osteoporosis is, that's when the bone gets thin, different from osteoarthritis, which is wearing of the cushion between the bones. But osteoporosis is when the bone density actually gets thin and is likely to break or fracture easy. I'm taking notes, Doc. This is good. Now, so someone is watching and is like, all right, Doc, great. I got to make a livelihood. My job requires that I sit a lot at work. So, what would you say to that person who's like, I can't quit my job? So, help me, Doc. What would you say?
Yeah, so it's all comes back to ergonomics. So ergonomics is basically, the definition is efficiency and safety. So you want to again sit up straight, chest out, shoulders down. You want to make sure your elbow is at a 90-degree angle when you are sitting, because even the chair I'm at right now, my elbow's kind of bent forward, so I'm not the
Mhm.
best example. But you want to make sure your elbow is at a 90-degree angle. Make sure your wrist has a pad so that you're not flopping it around all day with the mouse. Like, you have to have a nice pad. Your keyboard also needs to have a pad again, so that you're not typing and then causing other problems in your wrist. So everything has to be at neutral. So 90 degrees for the elbow, 180 degrees for the wrists. The other thing is feet flat on the floor.
Okay.
So posture, feet flat on the floor, and then looking straight ahead. I'm looking at a laptop right now, so I'm looking down a little bit. So again, I'm not in the ideal posture for a long day at work, but you want to make sure your screen is straight ahead. The other really important thing, and we're all guilty of this, is not crossing your legs when you're at work, because that strains one side of the muscle, gets tighter, and then you're lopsided. So you have one part of your leg is tighter, the other leg is weaker because you've been crossed your legs all day. So those are the really, really important things: is make sure feet are flat on the floor, elbows are at 90 degrees, your face is straight ahead, so that you're not looking down or not looking up. And another thing is that make sure everything's within reach. Because if you have to go and twist and turn to like pull to get a pen,
Mm.
you can easily get a spasm that way. So everything should be kind of within reach. It sometimes takes an extra minute in the day to get your desk settled. Um, but you don't want to, yeah, you don't, if the phone is too far, then you're constantly reaching for it and then you're twisting your neck to stay on the phone. So those are things that you got to watch out for.
I literally uncrossed my legs as you.
So did I.
I was like, okay. It almost feels a little stoic. I'll be honest with you, but it actually feels better. Like even my upper shoulder, just doing this, it feels better. So I guess for those who are sitting, not I guess the ideal is what you described, and you should try to position your desk in a way where all of that can be accommodated. And I think there are features, their desk, and there's so many options for that. So good information. All right. So I have those who are saying, well, good for you that you get to sit at work all day. Well, we don't get to do that. So what are tips would you say for those who stand a lot at work?
Yeah, so standing is also very important to take care of yourself. So the biggest thing when you're standing, shoes, you need to have supportive shoes. You cannot be wearing heels if you're standing all day, and you cannot be wearing flats. So something with like a support uh, that's like those clogs that we wear, or something that has like you don't want too much cushion, but a supportive shoe. The other thing is core. You need to have a strong core if you're going to be standing all day. Your spine needs protection around it, and so when you work those abdominal muscles, it protects the spine from leaning forward so that you can activate
Mhm.
it and it helps you stand up. The other thing I recommend, and I use this personally, is compression stockings. If you're standing all day, it helps keep the fluid coming up to your heart versus the gravity pulling it down. So wearing compression stockings, and they don't have to be too tight. I get like the lightest ones that they are just enough to kind of grab your legs. Um, and then taking breaks if it's possible. I know a lot of jobs where you are standing all day, but if you are able to take breaks and sit down, if you're not, then when you come home, you need to put your legs up above your heart. So it offsets the gravity that you've been doing all day.
Okay.
Um, Another tip is I like to use this tip for people who cook a lot is getting an anti-fatigue mat. You can get them everywhere. They're called they're called anti-fatigue mats. They're like made of this rubber-like material, and it gives you just enough buoyancy, bouncing, like I'd say just enough cushion. It's not the memory foam, but it's not just a hardwood either. It's just enough so that when you're standing all day cooking, you don't feel the stress of your back. So if you're at a place at work where they do allow an anti-fatigue mat, that would be ideal. And then um, stretching. If you are have a downtime, it's all about stretching, stretching, stretching. So if you can, if you're standing all day, if you could just do some 10 back bends, because again, you want to do the opposite of what you're doing all day, which is kind of forward. So
Okay.
10 back bends, you could do that and then bring your knee to your chest, and then do some quad stretches to just kind of keep that blood up higher flowing because it's all the gravity is going to push it all down. So compression stockings will put it up and then you keep stretching, and take breaks if you can.
Awesome. I like that you also said do the opposite of what you are doing all day. So if you're doing this all day, you want to stretch almost in the opposite direction so you can relieve the tension from the muscles from all day straining. Wow. Very, very useful information. I hope you guys are taking notes because this is I'm taking notes. So I have someone who's watching who's like, well, Doc, thank you for all the tips. I obviously have to make adjustments at work, but my back hurts. I went to see my primary care doctor, and I've done the X-ray. Yes, it shows arthritis. I don't want surgery. What options would I get if I were to come to you? Because I sense that a lot of patients get afraid. Well, if my doctor says they can't do anything, then my only option is surgery. So I'm just going to avoid them and just deal with the pain. But can we talk a little bit about some of the options you offer patients that are non-surgical that would actually improve their quality of life? Because I will still not say don't exercise or don't get active or don't do things you enjoy. Well, back pain can be a hindrance. So, what would you say to that question, Doc? What can you offer me outside of surgery?
Yeah, so I'm really the intermediary physician from your primary to the surgeon, because the surgeon is kind of your last stop. So anyone that has back pain that's not getting better with conservative care, which is medications or physical therapy, those are the patients I love to see so I can kind of take a better look at your back. If you're having pain just across your back, that's usually from your facet joints. Those are your twisting joints, the joints that twist from side to side and lean forward and back. You can actually inject those with medications. If
Okay.
we find that it is helping, there's a procedure where we actually burn the nerves to the facet joints. So we're burning nerves to the arthritis joints, and
Okay.
that can help reset everything for you. Um, the nerves grow back, so they grow back over 2 years. And I
Okay.
always tell my patients it's very similar to getting a root canal when you burn the nerve to the tooth. The tooth nerve doesn't grow back. Once you burn that, it's cemented, it's you're taken care of. But in the lower back, you can burn the nerves, so it's very safe. So if it doesn't work for you, nothing happens. The nerves grow back. But when the nerves grow back, your pain can come back. But it can take 2 years for the nerves to fully reconnect. So during those 2 years, I really, really emphasize healthy diet, healthy stretching program, exercise, just the typical, like, just get yourself in shape. And then when the nerves come back, we burn them again. And I've had people come back to me. And that's kind of a very consistent thing that I have people come back. And every 1 to 2 years, we burn them and then they're off and they feel great. And then they come back. So, it's not ideal that, like, it's not like a one procedure and then you're done for life.
Yeah.
We get to know each other for a while. So that's for pain just across the back. If you're getting pain down the leg, if it's shooting down the leg, that's when you get an epidural. It's not the type of epidural you get when you're pregnant and everyone
Mm.
asks, "Oh, is this epidural I'm getting?" No, it's the same space we're injecting,
Yeah.
but it's very helpful to calm inflammation down. Because if you're at the point where you cannot do therapy, you cannot exercise, you need to potentially get an injection to calm it down. And then
Mm.
I send you back to the therapist and have them work on exercises with you. So you can do a series of epidurals if your pain is down the leg. And then another injection, just kind of, I see a lot in women, unfortunately,
Mm.
or is the SI joint, your sacroiliac joint. That's the joint
Okay.
that's right behind your hips. And that can get inflamed after pregnancy. It can get inflamed just being a woman. It can get inflamed with trauma. It can get inflamed with lots of different things. I see it with a lot of
Mm.
people that have rheumatoid arthritis, ankylosing spondylitis. They also get that area that gets inflamed. So I can put medicine into the lower joints in your back, and that can help with lower back and hip pain. So those are kind of the three main things I offer. And again, it's always with a comprehensive program. You can't just get injections. You have to be doing all the other things with it,
Okay.
like lifestyle changes. And then once you're better, my mission is to keep you better. So then, we reinforce eating better, reinforce exercising more, reinforce stretching and all that stuff that we know we should be doing, but we
Right, to prevent flares. I agree with you, Doc. I agree with you. And I'm glad that you do what you do. So, for those who are watching, there are other options outside of surgery. And we have a good question here. Hi, Mitra. She says, hi. And she says, if you are burning the nerves for patients who are other types of medications, like do they have to avoid them, particularly blood thinners? Because that's one
so
of the
there
previous.
Yeah, that's a good question. So, some physicians do have you stop blood thinners for the ablations. I do not, because you're not going deep into the spine. I
Okay.
have you stop them for epidurals when we're going into the spine, closer to the nerves. But I've been doing this 10 years. They bleed a little more. It's not really a big issue.
Okay.
So I do
Okay.
not have you stop blood thinners.
Okay. Very good question. I hope that was helpful. Now, thank you so much for this, Dr. Khan. I've learned a lot, and I'm sure our viewers have as well. Um, and all of this I believe, help improve quality and quantity of life, because pain can be a deterrent to so many things. So, for those who are watching, who are like, Doc, you're in Philly. I believe the Eagles are doing so well.
Undefeated. Woo.
Really. And they're asking, where can we find you, Doc? Where can people reach out to you?
Sure. So my practice is called Concierge Spine and Sports Medicine. I am located in the Navy Yard, which is right by the Eagles, Phillies, the stadiums. And you can find me on Instagram, Dr. Malini Khanna. You can find me on TikTok, which is at Concierge Spine and Sports, LinkedIn. And then I also do have a YouTube channel, which is Malini Khanna MD. But really, if you are really frustrated with your lower back pain, the best thing is to come and see me in person so I can take a look at you. I do offer same day, next day appointments, and I have an online booking. So that's www.cssmpa.com. So go to my website and book an appointment to come see me. Also, you can go on the website and there's a ton of information about yoga stretches for lower back pain that can help you.
Awesome, awesome. Thank you so much for doing this. I appreciate the time and the effort to help improve the quality of life of our viewers. So thank you, thank you, thank you.
Thank you so much for having me.
My pleasure. All right, thank you all for watching. As always, sharing is caring. For those who know someone who could benefit from this video, please tag them. It's taggable and forward to them. This is shareable. All right, so thank you for watching. And on that note, if you or anyone you know is looking for an awesome, a thorough, and a passionate family physician who will refer you to doctors who can also help you feel better, I am she. Have a good one, guys. Bye.
Bye.
All right.